Well, a warm welcome to today's talk. It's Sunday the 16th of April. Now, there's some fascinating and somewhat frightening pathology coming out of Germany, looking at possible post-vaccination pathology. The obvious question is, why isn't this being done in the United Kingdom? Why isn't it being done in the United States? But let's go straight on to one specific example, and you can see if you want to watch the rest of the video. Now, the first example I want to look at, and I'll be giving you all the references for this shortly. This is post-vaccine, post-mortem blood clots. Now, I first heard of this from embalmers. I was contacted by embalmers who were washing out lots of blood clots. Well, what they thought was blood clots, it was like long, white, sort of strandy things, and they hadn't seen it before. This appears to be a new pathology. These embalmers, some with decades of experience, hadn't seen it before. And the pathologists don't seem to have seen it before either. So let's look at what this is. Now, here's a picture of it here that was given in Professor Burkhart's talk. And it's these long, strandy things. This particular one's from Adams 2022, who took the photo. These long strands coming out of the blood vessels of people that died. Now, the thing here is there's masses of these things, whatever they are, and they can't have formed in life because they were so extensive that the circulatory system would have been completely blocked off. So they are some post-mortem phenomena. They are developing after death. But they appear to be new. This is a new pathology, which is really remarkably strange that we're seeing new diseases after the centuries of pathological studies that we've had. So there's the stringy things there. Now, it's been identified by Professor Burkhart and his team. And I should say he's got various people working, from physical chemists and pathologists and histologists. And he's basically heading this team in Germany that's doing this research. So they hadn't seen this before, but they are saying it's not blood clot, so they've been able to kind of eliminate that possibility. It's formed after death because it's not compatible with life. But what Professor Burkhart is doing now is colleagues in surgery and medicine are sending him biopsies from living patients. So he started off looking at a series of 15 post-mortem patients from people that died post-vaccine, whether that was the cause or not. Although he did eliminate SARS coronavirus 2 infection in all of these patients and did identify the spike protein. So that is indicating that it's vaccine related rather than infection related. Because it would be hard to see how all the other parts of the SARS coronavirus 2 were somehow eliminated and only the spike protein was left. So very suggestive of a vaccine induced etiology or cause. Now, this is blood from a living patient. So, as we say, his physician colleagues and surgeon colleagues are sending biopsies. Now, this patient had quite severe ischemia, reduced blood supply to her feet. Now, there is a picture in the lecture if you want to see it. I haven't shown it because it's a bit distasteful. But it's there if you want to see it. Look on the original lecture, of course, and I'll give you the links to that. So they took a blood sample from this living lady. And when they looked at the blood, they spun the blood down as the hematologists normally do. And after they'd cooled it down, what they found is, so what we're looking at here, you expect to see this nice clear serum on the top. You expect to see this blood here, but what the heck is this big blob that developed after the blood was cooled is the question. So there it is again in a bit of a blow up. It's a very strange phenomena. I have only worked part-time in haematology. I'm no specialist, but I've never seen anything like this. And more importantly, the pathologists haven't seen anything like this either. So he took it out and he put it on that's the blob there taken out from the blood. And he's sending it round his colleagues who are specialist chemists and things like that. And they are analysing this to see what it is. So it really is a bit of a medical pathological mystery, just quite what is going on here. But we have a little more information. This is in section here. So this is a physical entity from his talk. This is the slide from his talk. Very few cells in it. And what it seems to be protein. So it seems to be a consolidation of protein previously dissolved in the blood. So what this blob seems to be, let's just have a look at that blob again, because it really is quite It's quite amazing. We've never seen anything like it. It's just a blob that formed in the blood when the blood was cooled. This really is new pathology. I can't think of any diseases where anything like this would occur. If you're a pathologist watching, and I am consulting pathologists at the moment, but so far we don't know about this. Do let me know, because it's currently a mystery. It seems to be protein. So what seems to happen is, after the blood sample is taken, these proteins were previously in solution in the blood, like in a solution. And then when the blood is cooled, they precipitate out of solution and form these blobs. And of course, if it's in blood vessels, so this was formed in a centrifuged blood specimen bottle, so it became globular, it became round. If it forms in long, thin blood vessels, then of course, just like a mould, it will mould to the shape of the blood vessels it forms in. And this seems to explain these long, stringy things that the embalmers were reporting to me probably 18 months ago. So where are we getting all this information from? So it's Professor Arne Burkhardt, and working with Walter Lang, another pathologist. Now, Professor Burkhardt is a pathologist with over 40 years experience, over 150 primary source research publications, an international reputable pathologist, medical doctor. And when people like this express concerns, I think we're pretty stupid, to be quite honest, if we don't listen. We've had the privilege on this channel of talking to some of the world's best scientists and doctors, and if we don't listen to those, why bother having scientists and doctors? We have to listen to them and at least take their questions seriously. If the minimum that the authorities in the UK do is take this question seriously and commission our own pathologists to do this work, then that's the minimum response that we would expect from any competent authorities. If they don't do that, I think we're free to question the competence of our authorities. Anyway, this is Professor Burkhardt here. This is his talk. As we say, highly experienced, highly reputable senior professor of pathology. Original German language presentation of his lecture is there. Check it out for yourself. It's called Autopsy and Histopathology Studies on Adverse Events and Deaths Leading to due to COVID-19 Vaccine, conducted at Reutlingen in Germany, where he's currently working. So a lot of this work is predicated on this immunohistopathology. So they're able to identify the histology, which is sort of the tissues, the immunity in the tissues, and they look for particular proteins. And what they're finding in these lesions is spike protein, but not the nucleocapsid protein. They're not finding the whole virus. They're just finding the part of the virus which is synthesized in the body after it's being stimulated by the vaccines. That's how we know we're not dealing with a post-COVID syndrome here. We're dealing with a post-vaccine syndrome, and more needs to be found out about this fairly urgently. That's the link to the translated page. It's the second conference on vaccine adverse events, English translation. Do check it out. Now, relatives started turning to pathologists in March 2022 onwards because they had loved ones dying, and their deaths were just not making any sense to them. So they clearly wanted to know why their relatives were dying, and pathologists make definitive post-mortem diagnoses, unfortunately. But the quality of the diagnoses are very good. It's pure, pathology is a fairly pure science, and it's by far the best way to find out why an individual is deceased. So that started in 2022. Suspected deaths might be vaccine caused, some of the relatives thought. Disturbing and very complex histological picture, Professor Burkhardt says. 15 pathology studies, but as we say now, is also getting biopsies and blood samples from other colleagues who've heard about his work and want to use it to diagnose their living patients. Right, more examples. Found patterns that can be attributed to vaccination. Now, methods. Before we do examples, histology, staining specimens, immunohistochemistry, advanced chemical methods, toxicological problem, and he, as I say, he recruits a lot of differentiated lesions. So the spike proteins there, they know it's not the true viral infection. They're doing all of these studies with a range of specialist colleagues, as we've said, in Germany. analytical, toxicological problems, things that have been overlooked in the past. Now, he says this is a poison at work which is produced in the body. This is a translation from German, of course, but we think it's pretty accurate, which means you must look into the tissues, which of course is what histopathologists do. Infection has been excluded. I don't think we can stress that strongly enough. He has been at great pains to exclude the possibility that this is infectious causes. Now, one methodology test he did, which you would expect, is this is the muscle where the vaccine is injected into, and you can see the brown spike protein being produced. Now, this is what we expect to happen. This is what should happen. So what should happen is the vaccine is injected into the arm. It stays local, which we now know it doesn't. And the cells in the arm should, and probably a few in your armpits in the lymph nodes, should produce the spike protein. So that is confirmed, and that confirms that his techniques are in fact working. That we see the brown staining of the spike protein in the muscle cells where it's supposed to be. But he says we are able now to prove that this can occur in almost cells in the organs in the body. So we saw this from the Freedom of Information Request Australian data, that this is happening all over the body, not just in the place where it was injected. And what he finds is a diffuse endothelialitis. So endo is in, thelial is the epithelial lining or the endothelial lining, and itis is inflammation of. So what's happening is that the vaccine is circulating around the body, and the vaccine is going into the cells which line our blood vessels. Could be anywhere, could be in the brain, could be in the heart. The vaccine mRNA is going into those cells. Those cells are expressing the spike protein. So you get spike protein expressed in cells, for example, in capillaries perfusing the myocardium, the heart muscle. And because the spike protein is foreign, the immune system then attacks these cells, and we're getting this inflammation in different parts of the body. That is what is happening. Active spike protein is produced, for example, in adipose tissue, clustering around the capillary endothelium. Now, again, this is fatty tissue here. Now, there is what we are seeing here. This is the capillary here. So we're seeing the brown spike protein produced in the capillary and fatty tissue. Now, this starts and stops here because it goes in and out the plane of the picture, which often happens in pathological specimens. But there is some spike protein being produced in the adipose tissue as well, because the vascular layer is so damaged that the mRNA is leaking out into the tissues, the very tissues of the body, going into body cells, in this case adipocytes in the fatty tissue, and producing spike protein there. And of course, that's going to have the associated inflammatory response. Here's another example here. This patient had again, this is a living patient, left swollen blood vessel with spike protein on the right, brown stained spike protein with obliterative vascularitis. Obliterative means that the inflammation in the blood vessels, the vasculitis, is so severe it's blocked off the vessel. So here we see a very swollen vessel in this one. Here we see the brown spike protein in this cross-section of the blood vessel, and here we see the spike protein has blocked off the blood vessel. So damage to endothelium, thrombogenic exposure. Now, this diagram here is a bit complicated, but these flat cells here are the normal endothelial cells. Now, I'm not going to go through the pathological stages because we'll be here all day. But what is basically happening is the spike protein is being produced by the vascular endothelial cells, the cells that line the blood vessels. As you would, that's what happens. It's not what's supposed to happen, but you would expect that if the systemic distribution of the vaccine. The immune system is then attacking these cells, destroying these cells. And what that means is you've taken away this top layer. You've taken away the top layer. So the underlayers is exposed, and that can cause clots. Because basically the body thinks it's been cut. It's induced thrombosis. So you get thrombosis induced due to the vascular damage because the underlying layers are thrombogenic. So that is what's happened there in that example. Foreign bodies are also found in the lungs, but not in the alveoli. The foreign bodies may be cholesterol. They appear to be cholesterol. So here's a foreign body there. That's not supposed to be there. But the air spaces are okay. It's not in the air spaces. And also the foreign bodies, the cholesterol can produce crystals. So here we see crystalline crystals of cholesterol. And the idea is that because the idea here is because the spike proteins damage the surface of the blood vessel, any cholesterol which was stored in the atheromatous plaques has been released. Now, this could in future, I suppose, be a potential treatment because you don't want the cholesterol in the atheromatous plaques. But it shows that the endothelium is being damaged and cholesterol is being released, and in this case forming these crystals. Accumulation of protein, there's amyloid type proteins being produced as well. So what is also finding is strange proteins. It's not actually amyloid protein, it's other types of protein, but protein seems to be accumulating in other parts of the body, particularly the brain, and the concern there is dementia. So do look at these original sources for yourself. Make sure I think my translations are fairly good. I am taking more consultations on this, but the video translation I think is fairly accurate as far as I'm able to tell. I recognise a lot of the pathological terms because they're much the same in German and English, and got a spattering of German, so it does seem to be good. If you're a native German speaker or bilingual or competent in German, do again tell me about the quality of the translations. We're on a learning exercise here. Questions have been asked, and authorities really need to answer these questions because we appear to be looking at new pathologies that haven't been seen before. So let's hope that the British and the UK, the European, with the rest of the European and the US authorities, Canadian, New Zealand, Australian, plenty of pathologists in those countries, they really need to start looking at this. Now they know what to look for. Now Professor Burkhardt and his team have said this is what you look for. It's easy for them to find now because they know what they're looking for. Let's hope this happens and hope we get some definitive answers. Because if we're dealing with completely new pathologies, that would be concerning. Thank you for watching.